Welcome back to my channel Aasta's Aura. So in today's video, let's discuss the comparison between MBBS as well as BDS to know which one's better for you. So without any further ado, let's start with the video. Firstly, let's understand how will you get admitted into a MBBS or a BDS college. So the answer for this, as you all know, is a very important entrance exam test which is called as NEET and which all students who admire to become doctors give. And it is compulsory to write if you want to get admitted in both dental and medical colleges. You're done writing your NEET exam and then you have your scorecards in your hand. This will decide that you will be getting a government medical college or a BDS college. So let's compare the marks. So you need a very high marks to get into a government medical college, whereas average marks would do for BDS government colleges. But this is 2024 and everything has changed, to be honest. So you need to study harder to get into both of the colleges. How many years do we have to study? Is that your question? Then for MBBS, we have to study for 5.5 years, where 4.5 years will be of studying and 1.5 years is of internship. But when we talk about BDS, we have to study for 5 years, where 4 years is of again studying and 1 year is rotational internship. Compulsory. When we talk about the number of colleges present in India, then there are plenty of MBBS colleges, whether it is a government or a private. But in BDS, that's not the case, because you can hardly find 1 or 2 government BDS colleges in a state, and private colleges are also very much less compared to MBBS. Now, is this a benefit or a loss? You will find it in the end of the video. Let's discuss the fees of both the colleges. When it comes to a government BDS or MBBS college, then the fees is reasonable, payable and very less. But this, when it turns around and comes to a private MBBS college, then its fees ranges in crores, and in BDS college they extend to few lakhs. When we talk about the subjects, then MBBS students study head, neck and upper limb, lower limb. They study the whole body in total. But BDS students are restricted only to head and neck. They don't study the lower body because it is pretty much not needed in our degree, as well as they study the teeth in whole depth, which MBBS students do not do. So when I told you that dental students study for 4 years, then the first 2 years is of both medical and dental subjects, but from 3rd year we go in whole detail only with dental subjects. Clinical exposure for both of these degrees is very important because they need to handle with living humans, right? So when it comes to MBBS, they know and they are taught of how to deal with a patient when it comes to the whole body, and in BDS we are centered to more of tooth-based knowledge. So in BDS, having skills, knowing how to work on a patient is your bread and butter, guys. Let's talk about the stipend that we get in our internship days. So in MBBS or BDS government colleges, you get a very nice amount of stipend that will be ranging from about 25 to 30,000, and MBBS के लिए और 10,000 या 5,000 ऐड कर लो. But when you talk about private colleges, whether BDS or MBBS, then you might be getting a little lesser because it is a private college, and उसमें भी like 1,500 or 2,000. I don't know, it ranges for different colleges, it is different. So the stipend is usually greater when it comes to government colleges. When we talk about the patient flow, it is much higher in government colleges than private colleges, both MBBS and BDS. But when we talk about the facilities, infrastructure, or other technologies, it is always the private college that wins the stand because they have introduced better and modern technologies to teach their students, which is a very good initiative. That is because also of the fees that we pay. When it comes to safety, I would like to tell that BDS is a much safer career for girls or anyone else because in MBBS, as we know, there occurs shift and postings. So आपको night shift में भेज दिया जाएगा और you have to work on 32 hours shift, 24 hours shift. But in BDS, आप आपके मन के मालिक हो. If you want to go to the clinic, go, sit there, work, or else come back. But I also talked about the safety because BDS में नाइट शिफ्ट ऐसा हो नहीं सकता बिकॉज इतना इमरजेंसी का केस कभी आता नहीं है. इफ इट कम्स ऑल्सो इट्स ऑलवेज ड्यूरिंग द डे टाइम. Now let's talk about the scope which we had talked in the earlier part of the video. So we have always heard people tell that BDS में scope ही नहीं है, क्यों ले रहे हो, MBBS लो और BAMS ले लो. But I would like to tell that see, everyone is becoming conscious about their self and how they look, especially when smartphones have been introduced. Everyone wants to look good on camera, they want to have a perfect smile. So people are concentrating more about their aesthetics and cosmetics, which will help BDS gain more access and more fame in the next years. Because आपको याद होगा कि 2008, back in 2008 when MBBS इतना easily सब नहीं कर पा रहे थे, तब engineering was in highest scope. जैसे कि अब MBBS है, everyone wanted to be engineer, but अब जाकर engineer has become very common and उसके वजह से salary भी कम हो गए हैं. So I doubt कि MBBS का इतना फोमो चल रहा है वो जाके भी in the next years ऐसे ना हो. I hope so, but ऐसे होने के बहुत सारे chances है. So तभी जाके BDS, because it's very less. See, colleges are less, students are less. When we see like that, BDS will be having a much higher scope and there are so many options after BDS that you can also do. So ऐसे नहीं है कि BDS में scope नहीं है. You have to just choose the right path for yourself because the right path includes the right college, the right people and the right schedule in which you study. See, dentists are specialized about the tooth, how they treat the tooth. So for example, when you have a toothache or caries, you don't go to a neurosurgeon or a cardiologist to go check and treat yourself. You will obviously go to a dentist, right? And dentists are a few in number when we compare them to doctors, MBBS doctors, physicians out in India. There, for every 10 population of a MBBS doctor, there are 1% of BDS doctors. So I hope this is enough to understand how much scope BDS has. BDS is also having a great scope. Please don't be depressed as you got a dental college and not a MBBS. It's on you how you work on yourself and be a better doctor, because it's MBBS or BDS. In the end, both of them are doctors and we are here to serve the mankind. So please don't be sad. That's all I have for today's video. Thank you for watching. If you have liked this video, then please subscribe to my YouTube channel Aastha's Aura. Until then, see you in the next one. Bye.